Hi friends, I'm Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about the role of fibroids in infertility and how do we know that can cause infertility. See, basically most of the fibroids are asymptomatic, but very few fibroids, especially submucosal fibroids and intramural fibroids, they are symptomatic. Even though the size is small, the patient usually comes to us with some symptoms like pain during menstruation, and some individuals they'll have pain even in between the periods as well, and some people they complain of dyspareunia. That's they'll have pain at the time of coital act, at the time of intercourse, and then some individuals will have vague dragging pain throughout the cycle. So that's how we usually suspect there might be some pelvic mass, and then we go ahead with an internal checkup. If we have any doubt, then we'll go ahead with the scans. So in the scan we'll know where exactly is the location of the fibroid. See, again, whether fibroid can lead to infertility or not, it depends on so many factors. First of all, the size of the fibroid. Is it small or big? Small in the sense less than 3 centimeters or more than 3 centimeters. Second most important is location of the fibroid. Where is it located? Is it in the intramural, within the uterus, or is it submucosal, which is completely inside the cavity? And is it distorting the endometrial cavity, the inner aspect of the uterus, is it getting disturbed because of fibroid? All these things can lead to infertility. And the third thing is most important is a corneal fibroid, where the tubal, at the site of tubal opening, if at all if there is a fibroid, intramural corneal fibroid, then that can even lead to tubal block. So that's how fibroid can lead to infertility. So how do we diagnose? So basically, first of all, history wise we'll get little bit idea, and the clinical examination will get at least 50% of the idea, and the rest of the thing we will confirm it with the help of ultrasound and some investigations. So and then when we do hysteroscopy, that's when we'll know what's the type of the fibroid, is it and of course even before hysteroscopy we do a 3D scan, transvaginal 3D scan. Even in 3D scan it is almost equal to hysteroscopy. In that scan we can make out what is the size of the fibroid, what is the exact location, is it intramural or is it submucosal, or is it disturbing the endometrial cavity, or is there any fibroid which is causing the tubal block. So after confirmation on 3D transvaginal 3D scan, then we pose the individuals for hysteroscopy. So in hysteroscopy we will enter inside the uterine cavity and we'll see if there are any submucosal fibroids. We can do submucosal fibroid resection, and even a part of intramural fibroids also we can do hysteroscopic resection of the fibroids. And then if it is a corneal fibroid causing a tubal blockage, gently we need to know it is posted through both laparoscopy and hysteroscopy, and then we try to remove the corneal fibroid and restore the tubal patency. So that's how and first of all presence of fibroid does not indicate that you won't conceive at all, and it again depends whether it affects the fertility or not. It again depends on the size of the fibroid, number of fibroids, and the most important is the location of the fibroids. If they are very small, not disturbing the cavity, and they are subserosal, no need to worry at all. If they are intramural or if they are submucosal, totally inside the uterus, then that's a concern that needs to be removed even before planning for the pregnancy. Because what happens without removal of the submucosal fibroid, if you conceive also, first of all the pregnancy won't get implanted. Even if it gets implanted, it is very difficult for the pregnancy to survive for a longer time. It can grow up to a certain stage, almost in the first trimester. Most of the miscarriages can happen by the end of first trimester, and either the growth of the baby would have been hampered, because improper placentation is one more reason if the pregnancy gets implanted on the fibroid. So these all can lead to pregnancy failures. So that's the reason, if at all if any submucosal fibroid is there, we usually advise the couple to go for myomectomy first, and then later on they can plan for pregnancy. So friends, in this video we just discussed about the role of fibroids in infertility, and what all type of fibroids can lead to infertility, and what are the indications for removal of a fibroid, how can we remove it, and what are the negative impacts if it doesn't remove the fibroid before planning for the pregnancy. So if you find the video is informative, please like my video and share with your friends and needy people. Thank you.